In OIT, patients are under the guidance of an allergist and they consume very tiny doses of what they're allergic to on a daily basis. This starts out with a visit to the clinic where, under the supervision of an allergist and under observation of medical staff, a patient consumes a small dose and is monitored. If they tolerate that dose, they then consume that dose on a daily basis to build immune system tolerance. With time, these doses are subsequently increased, which increases the amount of food allergen that that patient will tolerate. In doing this, they build up immune system tolerance. So OIT has two very significant benefits. First, it builds a safety margin because patients now tolerate larger amounts of foods and thus are at lower risk for allergic reactions with accidental exposure. And second, there's a big quality of life improvement and decrease in anxiety because patients and their parents feel less anxious about exposures because they have that safety margin built in. Many patients with food allergy have a crippling anxiety revolving around accidental exposure and the risk for reaction. This anxiety can cause a significant impairment in their quality of life. Patients who do OIT under the guidance of an allergist can have a significant improvement in quality of life because they have a higher safety margin that reduces their risk for reaction with accidental exposure, and because they have a reduction in anxiety revolving around accidental exposure of the food. I've had parents tell me that after oral immunotherapy, their children can eat fearlessly because they're confident that they are not going to have a reaction with accidental exposure.